Hi, my name is Dr. Rose Khavari. I am a urologist with Houston Methodist Hospital. Welcome to everything you wanted to know about multiple sclerosis and bladder problems. How common are bladder problems in multiple sclerosis? They're actually very common. Almost 1 out of 10 patients, when they're diagnosed with MS, they already have some bladder problems. If you think about it, the bladder and the pelvic floor is very well innervated. It have a very complex and sophisticated function to hold urine properly and empty urine properly. It needs a higher level of neural control from the brain, spinal cord, and peripheral nerves. In multiple sclerosis, we're going to have lesions in the brain, lesions in the spinal cord, so that communication between the bladder and the pelvic floor and the brain and the spinal cord is interrupted. So it's actually very common to have symptoms. Almost 90% of MS patients will have some symptom by the time over the next 15, 20 years of their diagnosis. So it's very common. And what are some of these symptoms or problems that multiple sclerosis patients experience? Bladder has two functions. It has to hold urine properly, and then it has to empty urine properly. The holding part is when me and you are sitting here comfortably talking, reading, watching a movie without being worried about our bladder. Now, in MS, there's going to be storage problems. So patient will have urinary frequency, there's really bothersome urgency. Sometimes the urgency is so strong that the urine will actually leak on the way to the bathroom. So they'll have incontinence episodes before they make it to the bathroom. And then the emptying part is when they actually go get to the bathroom, there's urinary hesitancy, there's difficulty starting a urine flow, or they can't empty their bladder all the way. There's residual of the urine that stays. And some patients actually have both storage problems with urinary frequency, urgency, and incontinence, and also bladder emptying problem. So they have mixed of a problem. The bladder emptying problem can also lead to urinary tract infections. It can lead to kidney failure, stones. There's a lot of consequences that comes with these abnormalities that patients experience with bladder symptoms. So what are some of the options available to manage these problems? I think number one, recommendations that I would have to patients with multiple sclerosis and their healthcare providers is that to discuss these options. Urinary bothers are really difficult to be brought up spontaneously, so I would encourage patients and healthcare providers to bring it up, to discuss this. And if patients do have problems, to have them refer to a urologist who takes care of neurogenic bladder patients. And then at that point, we will evaluate the bladder to see how much it's been affected by MS, how much it's been affected by the changes in the neural circuitry of the bladder. And then we have many options. We start with least invasive options, such as pelvic floor physical therapy, behavioral modifications. We have a lot of pharmacological options nowadays. And then even moving further, there are more interventional options now available for MS patients. We use bladder Botox, we use neuromodulations for the bladder, or a combination of thereof. At the end of the day, we do have to evaluate and monitor the patient's bladder and also their kidneys. So what are some of the future directions in management of MS bladder? I think we're actually in a very exciting time as far as research in the world of MS and MS bladder. There's a lot of interest and growth of literature that we should move a little bit away from bladder-centric treatments. Over the past 20 years, our MRI technologies have advanced. Now we've gotten much, much better at finding which regions of the brain and even spinal cord contribute to bladder function. For instance, our lab actually has focused on MS bladder, and we've been able to identify regions that are involved in the bladder control for MS. So now we're moved beyond that, and that has provided us novel targets to be able to modulate either invasively or non-invasively with brain stimulation to modulate the bladder circuitry and be able to restore some of the functions in the bladder, basically kind of try to address the problem where the problem starts, where the lesions are, not just at the bladder level. Thanks for watching everything you wanted to know about multiple sclerosis and bladder problems.